So, Dr. Haitham, did you read the stem?
Yes.
Tell me, how
I'm waiting
are you
for
going to
the
consent this patient? Which type of consent you are going to take from this patient?
which type of what?
Consent.
Consent. I don't know.
Okay. How to assess the mental capacity of this patient?
Mental capacity with this patient. I will where I will discuss ask the patient about his name, his orientation by time, place, persons.
Mm-hmm.
I will ask him if he can understand my instructions and reply this what he understand for me to me again.
Do you know any scoring system about that?
Yes, remember the scoring system, mental test. Mental test. I will ask patient.
Okay. Okay.
I will ask the patient. I will ask the patient about the date, time, place. Can count numbers in reverse from 20 to 1.
Mm-hmm. Okay. Can you see this X-ray? Dr. Haitham, are you there?
Yes, yes, AB
Mm-hmm.
post-anterior radiograph of the patient, chest, showing
Give me.
air under the diaphragm on the right side.
Okay. What's the first thing to look for the X-ray?
First thing, I will look for patient. First, we identify the X-ray itself as regarding the name of the patient, date of birth, date of taking this radiograph, then which part of the body radiographed. From this, show the ribs and the spine, heart, the chest and the upper abdomen. Then look for the bone itself. If there is any sign of fractures, any abnormality in the chest wall, then look for the cardiac shadow. Okay. Look for the costophrenic angles and the dome of the diaphragm on both sides. Also the spine, and to compare the patient is centralized or not. I think this is the most what I will concentrate for this exercise.
You mentioned that you see air under diaphragm, okay?
Yes, on the right side.
Causes of this pathology.
Suspected perforated vesicles.
What else?
Viscous. Okay.
Or what the causes of perforated vesicles, do you know?
What the viscous in such patient, for example, this patient non-steroidal anti-inflammatory is supposed to be the perforating peptic ulcer, because patient is had a history of osteoarthritis and long-term use of non-steroidal anti-inflammatory.
What other causes do you know for perforated vesicles?
And the cause of perforated vesicles, a patient also can steroids also can cause ulcer and cause perforation.
Other than
traumatic
steroids?
perforation. Traumatic perforation.
What's the common site of perforation on colon?
Common site perforation of colon, left side. Left colon, left colon.
What are the risk factors for peptic ulcer perforations?
In which patient or in general? This patient or in general?
General.
General cause of perforation?
Yes.
The use of treatment like drugs like anti-inflammatory or steroids.
Good.
Recurrent attack of perforation, recurrent attack of ulcers, recurrent attacks of ulcers.
Good. How you will manage this patient?
This patient will manage this patient,
This patient, yes.
Yes, critical case or managed patient according to ABCD protocol. I will evaluate his his airway regarding patency and breathing. Assess airway patency, assess breathing. Patient can ventilate with and saturation of O2 and chest wall movement. Then go to the circulation, assess all vitals, heart rate, pulse, blood pressure, circulation, pulse, blood pressure, heart rate. Then according to ABCD protocol, aid airway regarding patency.
Then after all of this, the medications?
After what?
After all of this, after stabilization of the patient, what else?
After stabilization patient regarding the circulation of air breathing, I will examine the abdomen of the patient, expose all the body of the patient and we examine him. Also check the disability of the patient regarding mentality and his orientation and his capacity also.
Okay, what's the surgical options can you offer for this patient?
Surgical option for perforation, the first surgical options. After stabilization, patient there's two options. They undermine
yes.
butchering, or if not response, well, reception anastomosis. And if in case of peritonitis, okay, do peritoneal toilet and they move to the peritoneum, remove all debris and the infected material in the abdomen after peritoneal cavity.
Do you know pump inhibitors?
The two pump inhibitors, yes.
Yes, proton pump inhibitors.
This patient needs ECG to evaluate his
how does it work?
Arrhythmia. Proton pump inhibitors like okay. This proton pump inhibitors affecting the hydrogen potassium ATPs, prevent the release of the hydrogen into the from the parietal cells into the stomach cavity. So prevent the joining of the hydrogen ion with the chloride ion in the gastric cavity and forming the HCl.
Comment on this ECG.
Okay. Regularity. And this ECG, this regularity. Okay, organism with loss of the B wave.
Okay, how to calculate the rate in this ECG?
As regarding distant, the not regular, I will count 10 big large squares. Okay. Divide on 6, the number of R on 6.
What are the causes of AF?
I don't remember this one.
How to manage fast atrial fibrillation?
Atrial fibrillation. I don't know.
Okay, well done, Dr. Haytham. With station. There is another part of the session will be done after by another candidate. Let me comment on you did well, but you have two things I need to comment about. The patient is confused, Dr. Haytham, so the consent you are taking from this patient is consent number 4. You understand? Because the patient is confused. Another thing, when you try to your answers as short as you can. When I ask you, you take a long time to comment on the X-ray. Interpret with this chest X-ray. Just tell air under diaphragm and neuroperitoneum. This is the pathology. What's the causes? You did it well. Perforated viscous. What's the type of perforated viscous? Maybe post-laparoscopic, post-procedure, anastomotic breakdown, penetrating trauma. You mentioned trauma. I think you tell me about the trauma. Yes. How you will manage this patient? You spend a lot of time speaking about ABC protocol. It's enough according to A, B, C, D, E airway, and then after you should mention the using of rehydrate the patient and pump inhibitors, analgesia, broad spectrum antibiotic, NG tube, electrolyte injection, all of this because the patient was vomiting and of course to the electrolyte disturbance. You didn't mention that. Try to be organized in this part for treating the patient. What else? You did well in how does proton pump inhibitors works. It's enough to speak that it's a blockage of irreversible blockage of hydrogen potassium ATPase, and don't stay a lot in this question. What else? As you see, there is a questions depends on the past questions. When he asks you about how to manage this patient, if you mention the proton pump inhibitors, so the next question will be how does proton pump inhibitors works? But overall, you just need to be more. You can categorize and be specific in your answers. But overall, you did well, Dr. Haitham. After the session, we will give you all the questions and the typical answers for it.
Doctor, please.
Yes, I'm here.
As regarding the X-ray, in many texts you mentioned that you should see go systematic. It's posterior anterior radiographs of the chest and the upper abdomen, and should read the name and date of birth to confirm this X-ray is belong to this patient.
He will guide you, Dr. Haitham. First, I asked you what's the pathology, what's the abnormality in this X-ray. If he asks you about the abnormality, you speak direct forward about this air under diaphragm.
Pathology. Okay.
That's why
we question directly. What the abnormality?
Yes. If he asks you comment on this X-ray, start systematically. Maybe he will stop you and speak with you. I need pathology only, or abnormality only.
Okay.
You got it?
To save time. Yes, to save time.
And I need from you, Dr. Haitham, to be prepared more than this. I need your answers. You can see now it's not about the information. I think you read this station before and you know this station, but answer quickly in the X-ray. It should be in just 8 seconds. Comment on this X-ray. It's air under diaphragm. ECG, it's absent wave, irregular rhythm. That means atrial fibrillation. Before the 9 minutes will not be you to finish all these questions. Any other questions, Dr. Haitham?
Thanks.
Well, the rest of the questions will be done with Dr. Nermeen. Dr. Nermeen, are you there? Dr. Nermeen is not here. Dr. Yazdani, are you there? Dr. Ahmed, are you there? Dr. Ahmed?
Yes, Dr. Muhammad.
Are you ready?
Yes, I am.
We will continue the same station with Dr. Haytham. We stopped on the question. What are the surgeries can you offer for this patient?
What are what?
The surgical option you
Okay, regarding the surgical option, we can go with the omental patch for the repair of the ulcer, or we can go with that selective truncal bacotomy.
Okay. How to manage fast atrial fibrillation?
For the atrial fibrillation, we can go for the ABC protocol if it was unstable. If it was stable, we can go for rate control by beta blockers, and there's also the amiodarone, and with the anticoagulation to guard against thromboembolism.
You mentioned the use of beta blockers, yes?
Yes.
What's the side effects of beta blocker?
The beta blocker causes bradycardia, it causes bronchoconstriction and bronchospasm, and also it will cause gastrointestinal abnormalities, nausea and vomiting.
What is pulseless deficit? You know what's the meaning of pulseless deficit?
Well, it occurs in cases of atrial fibrillation. Some beats doesn't reach the peripheral systems. So that's why there's a deficit in the pulse.
Okay. What's the physiological action of HCl?
The HCl, it's responsible for the food digestion and denaturation of proteins. It helps for activation of pepsinogen into pepsin, and it also helps to promote the pancreatic and small bowel secretion and the bile secretion.
Okay. Your colleague, Dr. Haytham, mentioned that to assess the mental capacity for this patient, he will use abbreviated mental test scoring. Do you know what's the abbreviated mental test scoring?
No, actually not. No, I don't know that.
Okay, thank you, Dr. Ahmed. You also did well.
You're welcome.
The typical answers will be shared now on Telegram group for the typical questions and typical answers for the stations. Thank you all. See you next station.